So welcome back. Now, Dr. Capozzi is a dermatologist or a skin doctor who actually is from Hungary, but he studies in Austria at the University of Vienna. And by 1881, he becomes the head or the director of their skin diseases department. And he is one of the first to classify skin rashes or skin lesions, as they are known, on a scientific basis, meaning where are they happening on the body? And then what, if you take a biopsy, what does it look like underneath the microscope? And so he is able to classify skin lupus as being something a little bit different than systemic lupus. Now, skin lupus is also known as cutaneous lupus erythematosus. And this is a disease that can be on its own. It can be its own, very own CLE disease, or it can be part of the systemic lupus, the one that attacks the whole body type. It's a very rare disease. So again, if we take that example of how many people do I need in a room for even one person to have this disease, it's probably around 3,000 to 4,000. As far as who is at risk for this disease, well, it does run in families, but it's not 100% genetic. It is more in Black people, it is more in smokers, but by far it is probably very common in those who have systemic lupus to begin with. And in fact, 80% or more of those patients that have the systemic disease will have some skin manifestation. Some of the triggers for this disease are things that can either cause it to come on the very first time or can make it worse are the sunlight, so which is called photosensitive, meaning it gets worse in the sun, certain medications, and certain viruses. As far as the types of this disease or the subtypes within this disease, there are three main ones. The first one is the malar rash, and that's the most commonly known as the butterfly rash of lupus, because that's where the patient will have redness right above their nose and right over their cheeks, but it will spare the nasolabial fold. So it'll spare this groove. It won't happen in this groove right here. It does get worse in the sun. It can be flat or it can be raised, so you can feel it. It lasts for days to weeks and it doesn't scar. The second type is a subacute cutaneous lesion, and these are kind of scaly looking. They have like a really good border, a really good outline that's sometimes raised, darker in color, and the center of this lesions are a little bit lighter in color. And these can happen on the neck or on the back or on the arms, basically wherever the sun will hit the body. And these will usually last for a couple of weeks to a couple of months. And again, they usually don't scar, but sometimes they can be a little itchy. Now, the third type, the discoid lesion, these are the ones that in the 1800s people were calling everything lupus, because this is the typical wolf bite-like lesion, meaning it's a raised, you can feel it, it has a raggedy red edge, and it can scar. It comes on the face and it comes on the scalp, and this is the one that can last for months to years even. As far as the diagnosis of this disease, again, it's mostly clinical. It's looking to see if the patient has the right type of skin lesions in the right places, and is it reacting the right way to the sun and things like that. Basically getting a good history and physical in, so it's a clinical diagnosis usually, and then using labs sometimes, or sometimes a biopsy if needed, to confirm the diagnosis. As far as the treatment of this disease, well, the easiest thing is to avoid the sunlight, because it does make this disease worse, and also to stop the smoking. And fun fact, some of our medications don't work if patients are smokers. They just can't activate the right way inside the body. Sometimes creams can be used, and then sometimes medications that will either tweak the immune system and others that will actually push it down. And sometimes a dermatologist can actually inject these skin lesions with various medications like steroids to kind of calm it down and to calm it from spreading. As far as the long-term outlook for these patients, it's actually pretty good. About half of these patients, the disease resolves without any really treatment that's needed. About half will need treatment, but about 20% or about a fifth will go on to develop the systemic lupus, the type that is attacking the body, not just on the outside, but also on the inside. But in summary, probably the hardest thing about this disease, again, it's a very rare disease, and so diagnosing it correctly. It often gets mistaken for other things, but more often other things get mistaken for it. And a lab test doesn't make the diagnosis alone. So really looking at the patient, listening to the patient, seeing if these lesions are in the right place and are they reacting the right way, especially when it comes to sunlight. As our friend Dr. Osler would say, the value of experience is not in seeing much, but in seeing wisely. Until next time.